Canada's battle against COVID-19 is at a critical stage. We know many of you continue to have questions, and we will continue to answer as many as we can. Tonight, we're joined by infectious disease specialist Dr. Srinivas Murthy in Vancouver and Dr. Isaac Bogosh in Toronto. And Dr. Murthy, let me begin with you. This is an interesting and a little bit complicated question. What are the recommendations for kids traveling between houses of separated parents during COVID-19?
Yeah, it's a complicated question that actually the Ontario courts just ruled on a couple of days ago. And they currently say that the child should remain in the same situation they were in beforehand. However, they did qualify that with some common sense in that if one of the households was at more risk than the other, or was there any difference in the households in terms of transmissibility, that they would recommend staying with the less transmissible house for obvious reasons.
So how would that play out? I mean, again, I know it's complicated, but what's the relatively short answer of how to do that safely?
Just using common sense, basically. So if you had a drop-off spot that was in a public place, change that. If the transport was complicated and used public transport, you'd have to change that as well. But if it's a quick drive from one house to the other, then you can maintain that relationship as long as it's reasonably controlled.
All right, Dr. Bogosh, next question to you. I have asthma and so does my child. My job is deemed essential. Should I be going to work?
I think that's a challenging question because, obviously not all asthma is the same. And truly, if someone is at significant risk of having a really bad asthma exacerbation and, someone who might have hospitalizations from this, it might be worth discussing with the employer about perhaps changing their role at work, because we really obviously need to avoid individuals getting this infection. And of course, we know some people are more prone to more serious outcomes, and asthma may be one of those underlying conditions that may put someone at risk of having a more serious infection. So it might be worth speaking to the employer about switching up the job for at least the time being to really reduce the risk of getting the COVID-19 infection.
Dr. Murthy, what do we know about how the virus affects children under a year old?
To be truthful, we don't know that much, in that there hasn't been too many cases reported in hospitals in Canada and across North America. I just looked up, there's been about only 3 or 4 deaths in children across the whole United States outbreak. And so we're still learning a lot. Whether that means that children don't have severe disease or whether that means children just don't have as much disease, we still need to do a lot of testing to figure that out.
We have about 35 seconds. Dr. Bogosh, I know both of you actually have answered this question before, but we still keep getting the question, so I'll put it to you. How do you determine whether someone has recovered from COVID-19?
It's a bit different in different locations. So some places would actually do another test, and some places that would actually do two tests to make sure a person is negative. Other places are just saying, once your symptoms have resolved, you should wait for X number of days, and that X can be different. So some places are saying wait 3 days, some places are saying wait 7 days, some places are saying wait 14 days. So there's a bit of heterogeneity to determine if someone has truly recovered.
Well, no matter how many times you've answered that question, you still make it interesting. Thanks to both of you for answering all of these questions tonight.
Have a great night.
Take care.